85% of women will be pregnant at some point in their lives.
There is zero evidence out there whatsoever to show that training during pregnancy causes any harm to either you as the mother or your baby.
It can take up to a year to fully recover. You will always be postnatal.
We've seen firsthand not just them training through pregnancy and it helping their labour, but then afterwards as well.
Improving your mood, shorter labours, fewer complications during labour.
Stay active when you are pregnant. It is the biggest bit of advice I could give.
Hello and welcome to the T2 Fit Talks podcast, where we aim to educate and inspire individuals to achieve their full potential. I'm your host JT, and today in episode 7 we're looking to debunk 3 myths around pre and postnatal training. And here to share their knowledge and experience we have T2 Fit's very own Amy Darch and Gemma Hallett. How are you both?
Very good,
Move this way now. Yeah.
Honoured to be asked back.
I know, second time. But first time on the sofa.
Yeah, it definitely feels different.
Because it was a chair last time, right? Yeah.
It was nice and close to Gem.
Very, very close. First time for you, Gem. How's it feeling?
I'm a bit nervous. Is that okay?
You're absolutely allowed. And this is your first time on a podcast ever, right?
Yeah, no one's ever invited me. I'm not sure if that's like we'll find out, won't we?
Well, we'll see if you get invite number 2. We're off to a good start.
No pressure.
We're off to a good start. You were here on time, all that kind of stuff. It's all good. So we're looking at 3 myths around pre and postnatal training. But one of the first things I wanted to kind of dive into was, I guess, almost a personal question, like my own thing. I've been around kind of pre and postnatal training for a while. My wife's qualified in it. I still find it just amazing that there is so much noise out there. And I think noise is a really good word that you mentioned a minute ago about just what you should be doing, what you shouldn't be doing, different kind of guidelines in this country, different countries. Why do you think we still have this kind of loss of clarity around it? I know it's getting better, but why is it still there, do you think?
I think there's a few reasons, but I think firstly you've got to look at the fact that pregnancy and doing research in pregnancy is quite a challenge, because it's not the most ethical thing to do research on pregnant women. So often a lot of the guidelines anyway is just erring on the side of caution, because they don't want to say the wrong thing because the repercussions are quite big. But also there definitely is a lot of research now, and guidelines, at least for most countries, are pretty well defined. But I think that point you mentioned around noise is really important, because like with many topics, someone else can jump on and say something, and then someone else can say something, and then suddenly you have like all of these conflicting thoughts with social media, just the internet in general, unqualified people, that it makes pregnant women and people that are about to embark on that journey so confused, because to them it seems like one person's saying this, another person's saying this, another person saying, what can I actually do?
Yeah. And I guess it is just a very confusing time. It's a very scary time, right? So if you're hearing all these different things, it can just be really scary.
Yeah, and especially when it's your first pregnancy as well. And unfortunately, like things like miscarriage are really common. You don't want to do anything wrong. That's not even just around training. It's around your whole lifestyle. You're constantly paranoid about whether you are doing the right thing. So if you're hearing different voices saying different things as well, that's only making things worse.
Of course. Jen, what are your thoughts?
And there's still like this element of like judgment around it, and we talked about it earlier, how other people's voices and opinions, whether they're qualified, whether they're actually coming from a place of fact, you do feel there can be that element of like judgment, when actually, as we're going to talk about, it is healthy. There are many benefits, but some of the other opinions are speaking louder, and it's a scary place when there are people talking about things that they're actually not qualified in.
Yeah,
I even have to hide a few things from my own mum. She doesn't know half the things that I do, just because again, from her generation, her thoughts on what training can look like, should look like. It wasn't long before that they were saying to bed rest for 9 months, and so she sees me pick up anyway, and she's like, "Oh my goodness, what are you doing?"
Yeah.
So
she'd be having kittens watching you. Right now.
I mean, she just doesn't need to know about it.
But if you think if your own mum or your own grandma or your own aunt are saying to you, oh, you shouldn't do that, you shouldn't do that, those are the people that you've always looked to for guidance, for support, for advice. If they're saying it to you, there's a part of you that's going to listen, whether like you know the research around it or you aren't familiar about it. Those are the people you've always taken advice from. So why would you suddenly start not listening to them in a time where like in like a more scary or more vulnerable time?
So how do you actually just try and block the noise out? Like with all these different bits of information flying around, how do you go, okay, well actually I think I'm going to listen to this, or this is going to be the best thing for me? Like where do you actually start with that?
I think luckily for me, I'm pretty well educated in this area, so that in itself gives me a lot of confidence. So even when people like my mum are saying things, sorry if you're watching this, mum, she definitely might be watching. But even when people that are close to me are saying things, I still feel very confident in my knowledge and my ability to carry on as I would. But I completely appreciate that a lot of people that will be watching this aren't going to be in that same place. But I think it's just important to go with somebody that is reputable to get your knowledge from, and whether that's a qualified coach in that area. And then you've got the NHS and like the Royal College of Gynecology and Obstetrics. That is where the research is coming from, and they are saying all of the stuff that's true. And I think when you can go with somebody that you trust like that, you don't need to worry about all of the rest of the noise.
True.
No, I can't agree more. Surround yourself with information from the reputable sources, as Amy said, with coaches and healthcare professionals. Speak to your GP. Those are the people who have the information, and make sure they're the voices that you're listening to the most.
Yeah. And then just be sensible, listen to your body, and there'll be a few things that we'll touch on in a second about kind of working at different RPEs, that kind of stuff. But just kind of live your own journey to a certain extent, right?
100%.
Yeah.
It's completely
100%.
individual.
Perfect.
Yeah.
Awesome. So, our very first myth. I've heard this quite a lot, and it kind of still, again, just astounds me that you shouldn't be training when you're pregnant. It can actually be harmful to the mother and to the child. But I'm also going to tie in that you shouldn't start training if you haven't kind of, really trained before when you're pregnant. Like, that clearly is a myth. Where does that even come from? And, why should we be looking to train?
I mean, I think it's very generational. I think, like I said just a minute ago, going from that point of we were meant to put our feet up and not do anything, then to now where we're at, I think, things have transformed massively. I think, first and foremost, women should be really encouraged that there is zero evidence out there whatsoever to show that training during pregnancy causes any harm to either you as the mother or your baby. So you should take real good confidence in that. And then not only is it okay to do, but it is recommended. There are so many positive benefits from training for both you and your unborn child that, and like we said, these researched bodies of people are saying that it's recommended to do. So I think that people should just take confidence, despite the fact that they might be feeling nervous, despite the fact that they might feel, actually, should I, shouldn't I? There's no research to say that there's any negative impact. So I think, just take encouragement from that first and foremost.
And what actually are some of the benefits to training through your pregnancy?
So, there's such a long list. Even just thinking about it in the sense of exercise, even when you're not pregnant, think about improving your mood. Think about the mental health benefits. But even pregnancy-wise, you're thinking about the idea that it's proven for shorter labours, for fewer complications during labour, for helping with lessen the chance of gestational diabetes. Also for lowering blood sugar levels. Like we were saying earlier, 85% of women will be pregnant at some point in their lives. So that is a huge percentage of women who, if people are saying don't exercise, that's a huge proportion of the population not exercising for long periods of their life.
Yeah.
Yeah, definitely. And I've been through it myself. We've trained many people at T2 Fit and outside of T2 Fit that we've seen firsthand, not just them training through pregnancy and it helping their labour, but then afterwards as well. That's the biggest personal learning I had from training through pregnancy, and then the after bit. I didn't even think about the after bit until I was kind of there. And then I was like, oh, do you know what, actually my recovery is so much better than a lot of people that I know that hadn't trained. And whether that was the reason or not, who will ever know. But I think you've got to give yourself the best chance of staying strong mentally, like Gemma said, but physically, like posturally, like not having a lot of aches and pains that you might get through pregnancy, lower back pain, hip pain. These are things that can be really helped if you are staying strong and training throughout pregnancy.
And what about for someone who is maybe coming into the gym for the first time? They've just found out they're pregnant, or whatever stage during that pregnancy they've just come into, let's say a T2 Fit, for example. What kind of guidelines should they be looking to follow? What should they be looking for? What advice should they be looking for from their coaches?
Yeah, I guess that goes back to that myth that you were saying about don't start anything new. And whilst I wouldn't be recommended that you take up any kind of weird extreme activity, I think that if you're in the right place, if you're in an environment in the gym where you're with somebody who can help coach you through, then you can absolutely start training while you are pregnant. It all just comes down to just managing the intensity and knowing that it's maybe not the right time to start absolutely maxing out on lifts in the gym. But I think even if you are a beginner, you're going to be taking things that little bit more slowly anyway. So that's no bad thing. And if you've got the right people around you that can kind of watch over your form and make sure you're doing things as they should be done, then there's no reason why that shouldn't be a safe environment for you to walk into, not trained before or trained before.
And what kind of ways can we, in the gym environment, let's say, actually start to monitor and manage those kind of intensity levels?
I want to think about your environment to start with, like making sure you're well hydrated, there's water available, good like ventilation, so you're keeping cool, because you are going to become warmer quicker than someone who isn't pregnant in your session, for instance. Then on top of that, to actually know what kind of intensity you're working at during a session, you could use you could see if you're able to talk during an exercise. We know that you're at a good intensity. If I was to ask you a question and you would have to gasp for breath between each word, or it would be like 1 minute, Gemma, then I would say the intensity is too high. So you want to be able to use the talk test and as a really good kind of rule of thumb, and that's what you could be doing during a session. If you can turn around and ask the coach a question, you're probably working at a good intensity.
What about the RPE scale as well?
As a coach, you can use it as a level. You don't want to be working at 10 out of 10 in a session. 10 out of 10 is your max effort, but equally, you don't need to be working at like a 2 or 3 or 4. You can be working at an intensity which you find challenging, but not to the point where, like Amy said, we're going for a PB. We can be working with the idea that we have reps in reserve each time and go with that.
I think the RPE, I guess, the reason that jumps out to me is it's something that obviously you can use as a coach, but it's something that you could use if you were training on your own. You didn't have someone to maybe talk to in the gym and use that talk test. I think that RPE scale can be really beneficial. We're going to touch on the nutritional stuff in a little bit, but I know for a fact that when I've trained some people in the gym and outside before, one of the reasons that you really want to train and, if anything, try and drive intensity up during that time is because they are worried about putting on excess weight, excess fat, right? And we'll come on to that a bit in a second. But if you have someone kind of in that conversation, what would be your main bit of advice? Because mine is, you're not looking for progression right now. It's a case of just staying fit, strong, healthy, a nice maintenance level, and just kind of enjoying this whole journey, enjoying your training a bit more. Would you kind of disagree with that?
100%. I think as well for someone, like me, I love training. We trained for a long time, and I think mentally getting over the fact that I'm not doing PDBs and actually my weights on the bar are starting to decline. that's okay. Like, I've got to make peace with that and know that actually progression for me right now is turning up to sessions, ticking the boxes, making sure that everything I do feels good, and at the end of the session you will feel better for it. So I think that, yeah, you just have to, it's part of a phase of your life, it's a part of your journey. If you can keep ticking boxes and try and stay as strong as you can throughout that process, then that journey back after you've had a baby will be so much better and so much easier. But I think it's just, yeah, staying steady and consistent.
Do you think you could even flip it into a positive and go, well, actually, this could be a really good time for you to start working on some weaknesses, like working through tempos a little bit, working through some better shoulder health, some posterior chain strength, sorry. So could you flip it and have that positivity there?
Oh, definitely. I think it's always important to be thinking about your, like, the end goal with this. Like, the energy required to give birth, they say, is the equivalent of running a marathon. You wouldn't go into a marathon without, like, prepping your body for it. So why would you not prep for your labour?
Most wouldn't anyway.
Well, most wouldn't. I definitely wouldn't. Most people...
Prep for labour, though.
She'll prep for labour, but she won't prep for that.
Yeah, fair.
But if you're thinking that, yeah, if posterior chain work, if we're able to strengthen through our back, it's going to improve our posture. And even if you aren't pregnant, that's a brilliant thing to be doing anyway. So now on top of that, you're thinking, right, I can use this, using these exercises like pull exercises, deadlifts, anything that's going to hit into my hamstrings, my glutes, my lats, all of those are actually only going to help me pregnancy, postnatally, and afterwards. Then it's kind of like a win-win, really, isn't it?
Agreed. We're going to move on to number 2, our second myth. And this is, again, always one that I find interesting, is that you shouldn't core train, or you shouldn't train your core when you're pregnant. And I guess I'll kick it off a little bit. It's kind of understanding the bigger picture of what the core is, I guess, to a certain degree. But yeah, what should the guidelines and the parameters be around core training?
Yeah, well, I think what you just touched on there is really, really key. Like, the core is not just the superficial ab muscles that sit on the front of our tummy. Like, they're the whole structure that stabilizes your body and allows you to perform many day-to-day functional exercises. So, you know, you've got a growing baby inside of you. Your body's going to change with that. It is absolutely a fundamental thing, I would say, to keep your core foundation really strong. There are definitely ways to do it and ways that I wouldn't necessarily recommend to do it, but certainly I would say that pregnant women should all include an element of core training. And we know that if you are, for example, lifting in the gym, we know that a lot of the main, like, compound bigger exercises that we do would support that anyway. But then aside from that, yeah, you might just be looking to not train certain patterns of core training and try and get your overall core strong, I would say.
So Jem, what kind of movements, what kind of exercises actually would you start to encourage someone to do? And I appreciate that might change through the different trimesters, but what kind of things would you be looking at?
I'd definitely be looking at forms of carries. If you're thinking that postnatally, your baby, for want of a better word, is a load, and they're going to only increase in weight as they get bigger. So we want to be thinking like a suitcase carry is fantastic, but think about where you actually hold, like, your kettlebell or dumbbell. Not only could you hold it by your side, you're going to be carrying your baby on your shoulder. Pop it on the shoulder by thinking about things which are actually going to be like relatable outside of the gym as well. So that would be like a perfect example, would be a carry. Things like a pallet press, any kind of like anti-rotational work would be really good as well. All of those are just really like super beneficial.
Yeah. And would you, I say would you, I know you would do, but would you include, I think this goes also just outside of pregnancy as well, but definitely within pregnancy, start thinking about, again, the core is a bigger picture and going, well, if I actually think about my diaphragm, my pelvic floor, TVA, that kind of stuff, and actually starting to bring some strength and even just some awareness, considering we're just incredibly unaware of those muscles most of the time, bring some awareness to that. How would you maybe kickstart that off with someone?
That's been something that I personally have been, like you said about that slowing down in pregnancy, or just changing the focusing something else. That for me has been like a really big thing. And I think a lot of women, and I'm often surprised a lot of women how much they struggle to even understand what that is, how it should feel, what they're trying to connect at certain times. It can feel like a bit of a minefield. So often, if you can spend 5 or 10 minutes not in the training setting while you're doing exercises, either sitting down, lying down if you're in that first bit as well, and try and find that connection between your diaphragm and your pelvic floor, because we want the pelvic floor to be really strong, but we also want it to be able to relax as well. So I think if you can find that 5-10 minutes, whether that's daily, whether that's every other day, and start building that in as a consistent habit that you do across your pregnancy, it's amazing. And you should do it anyway, but I think pregnancy is a good time to try and focus and restart. And then once you kind of have a bit more of an understanding of what you're trying to connect and how it should feel, then it makes more sense when it comes to training itself. Yep. But I think it can be quite hard for women to figure out how that feels initially. So
we've touched on the core work in terms of when you actually are pregnant. Mm-hmm. Let's think post-birth. So what would the core work look like at that point? I'm assuming that the breathing side, the diaphragmatic stuff would be a big part of that. What would the kind of return to training look like in terms of the core work?
I guess it's important to note that it's going to be very similar whether you've had a vaginal birth or a C-section birth. Like, we're looking to achieve like diaphragmatic breathing, where you're actually breathing not just into your chest but actually into the rib cage. You want that expansion of the rib cage, because when you do inhale and when that diaphragm does move down, the rib cage expands. We're looking for the pelvic floor to relax. And then equally, when you go to exhale and the diaphragm domes, so we're expelling the air, we are looking to then draw in and up, engage that pelvic floor. They should work together as a pair, mirror each other like a piston effect. And then you obviously, like Amy was saying, having your TVA wrapping around you. So you can almost think of it like a can, where your diaphragm's the lid, where your pelvic floor is like the base of the can, and your core, your TVA, wraps around like the label. So we do want to get that coordination, that talking coming back again. And you think if someone had a C-section, someone is actually has affected that connection, has cut through that connection to some extent as well. Mm-hmm. So we can start really simply, like postnatally, just with breathing, just with thinking about, if I inhale, can I actually fully relax my pelvic floor completely? And then looking, when I exhale, can I engage it? But I guess there's also a lot of, when people say engage your pelvic floor, it feels like a bit of like a buzz phrase, like do it, and like people then look at you like, am I doing it? Like, what is it? Like, there's all sorts of like analogies out there, but like a couple that I think, like anatomically speaking, you'd be looking for your coccyx and your pubic bone to move in towards each other, and then you'd be looking to draw up. So you do need that idea of drawing in and up. If you need a more like kind of visual thing, there's some awful ones out there. Like, there's this idea I've read so many where you're like, that's a bit gross. There's the idea of like picking up a handkerchief. So you draw all 4 corners of the handkerchief to the middle and you pick it up. Mm-hmm. There's ones that if you had like a puddle and you use a straw in the middle and you draw the liquid into the straw and then up the straw. There's ones for men as well, like all sorts. But if you find one that works for you, then that's fantastic. But if you can get some of that pelvic floor and that idea of inhale and relax, exhale and engage in prenatally, then you've already kind of set yourself up quite well postnatally, because sometimes half the challenge is actually getting them to talk to each other. But if you have an idea on how to do it prenatally, then you're just going to give yourself a little bit of a head start. But it does take patience. You've got to be patient with it. It's not going to be a quick fix. It can take up to a year to fully recover. Some people will take longer than that. It's not the case of you get your 6-week sign off from your doctor or you get your 12-week check, whatever. That doesn't then mean everything's back to how it was before. You will always be postnatal. You will always have had a baby. And it is going to be a level of like rehab. You'd rehab after having like a knee op or some kind of injury. You should definitely be looking to use this as an opportunity to rehab and come back stronger. But you are going to come back differently.
Yeah. I think the patience and trying to drive some better awareness is key, especially when you think of a C-section and what actually that involves and the tissues that you're actually going to be cutting through. That is going to be taking a lot of time, a lot of awareness to come back from that. And I actually really like what you said there. I often, myself, even just forget about it. You're always postnatal. I think that's a really big thing. It's a big takeaway. There's always going to be that element of that awareness there. But when we're talking about core training we have to talk about diastasis recti. Explain for me actually what that is.
So you've essentially got your rectus abdominis, the muscles that sit right at the front of you think of it like a six-pack if you can see them, but everyone has got a six-pack. And they sit there and you've got a connective tissue in between called the linea alba. That's all sounds very fancy and complicated, but essentially as you place in more load on the front of the tummy where your belly is growing because you've got the baby in there, there's a degree of separation that happens. And that's completely normal. I don't know exactly the stats on it, but it's like over half, I think about 60-70% of women get some degree of it during their pregnancy. So it's completely normal. And I think when you're training during pregnancy, that is something you have to be really mindful of, because with core exercises, we just want to make sure that separation is not going to get any worse by doing the exercises, which is why we would probably try to avoid, we'd call abdominal flexion, but it's just things like sitting up in a sit-up position, doing bicycle crunches, holding onto the bar and doing leg raises, things like that, because those are the kinds of exercises that can bring it apart even further. But it's totally normal, and it's to be expected in pregnancy. I think also once you've had the baby, the goal is to try and draw those muscles a little bit closer together, and that, like you said, takes some time. Lots of women will never achieve a full kind of closure back to where they were at the beginning, and again, that's okay. It's all about trying to manage the intensity and manage the pressure that's going on in that chain, and over time you will start to build like different pathways to be able to create that core stability and core tension without necessarily having those muscles fully draw back together. But also that's why it can be important, especially if you have gone through quite a traumatic birth, or there's been a few complications and you know you've got a big degree of separation. It is always worth seeing like a pelvic floor physio afterwards, just to kind of make sure that you're doing the right things and things are okay, or going to see a PT that is qualified, because when you come back to training, it's just important that we don't want to kind of let that gap get bigger again.
And am I right in saying that those abdominal muscles can initially actually start to come back together pretty well, but then at some point in the future they can actually start to kind of re-separate almost? Is that something that can naturally happen, or is that very much down to the training and the kind of the exercise and daily lifestyle that they're leading?
So some people, they'll come back together naturally. Some people will find that they don't. And I think it's really important to note that for some people, they might never come back together. And it's not, and that's okay. Like Amy was saying, that's absolutely fine. It's about creating functionality. But we also want to make sure, like you were saying, that we're doing everything, like with our breath work, with our pelvic floor engagement, to create. We go back to that idea we talked about earlier about the can. We want to be thinking about about the intra-abdominal pressure within that. And if, for instance, we're not managing that intra-abdominal pressure, and that could even like when I'm talking to you now, there's really low level intra-abdominal pressure in my body. But if I was to sneeze, it creates quite a high level, and that pressure has to go somewhere. If I'm not managing that effectively, that could then come back as feedback, maybe in the sense of coning. So coning would be where that linea alba tissue is, where potentially you see like either a small dome. It can come back in the idea of feedback of leaking, of urine or feces or pelvic pain, all of those. And they're all things that are common, but they're not normal. So it's something to not be scared of, but it's also something to think, right, in that moment, I potentially didn't manage that feedback effectively. So if that was to happen again, I know I need to, if I was to sneeze again next time, I should really engage my pelvic floor. But equally, if I do that and I'm still experiencing feedback, I would be looking to knowing that that's not what again, it's common, but it's not. So we want to be thinking about then talking to our healthcare professionals, talking to your women's health physiotherapist, having a mummy MOT, any of those kinds of things so that we know where our body's at.
I feel like a lot of women actually do just pass it off as a normal thing.
Well, it's a massive bugbear of mine.
Yeah.
There's a Tenor Lady advert
Oh,
at the
that
moment.
advert's horrible.
Yeah.
Where girls are training in the gym,
Yeah.
and they're like, "Don't worry, girls, just put your panty liner in. It's gonna be all right. Like
Yeah.
you can keep lifting heavy." It's like that is not okay.
Yeah.
I think it's there's a massive educational piece to be done. I think the whole subject is and has been fairly taboo. I guess it is like a bit of an embarrassing topic. And so women have probably just gone, do you know what, it's just happening and I need to just, put plaster over it essentially by putting the Tenor Lady in. But I think that it's, even if you've come back from prolapse, even if you've come back from having like a traumatic birth, you can get yourself into a position where you're not having leakage and you're able to, like Jem said, you're able to manage that pressure. It's just all about understanding that relationship with the breathwork and the pelvic floor to know that actually it's okay, I can come back from this and it is normal.
Do you think there just
normal?
Do you think there just needs to be some better aftercare, some better quality information,
Yeah, so
like
badly.
in the early stages, like just to
100%.
actually have this education and get everyone on the right path?
Sorry,
go on.
Amy.
Sorry, that was my fault. No, it's another big one. Because I think a lot of other countries do it better. I know someone that had a baby in France, and they, as part of like their NHS, they had a pelvic floor physio, and they literally had a mummy MOT to say, like, you've had your baby, well done. Let me just check you out to see if you're okay. I think when you have your baby, you literally it's like, bye, well done. Is your baby okay? Do all the checks on the baby. Everything's fine. Is it healthy? Yeah. And then you're just meant to like figure it all out on your own and forget the fact that you've got to try and breastfeed, deal with not having much sleep, deal with like the aftermath of your body. But then you've got to think about yourself. Are all these things happening? Am I in control of them? What do I actually do to start? Like it is a minefield. But I think this country, and I think there's a lot of people now, like a lot of educators that I follow, that are really trying to campaign to get that as part of the normal aftercare that happens with women once they've had their baby, because it is so important, and we can get women feeling like they're getting back towards where they were, then they're going to be much more confident, they're going to feel much better about themselves, and ultimately be a better mum, rather than just kind of leaving them and going, it's all right, see you later, hold on, you've had your baby now.
Away you go.
Away you go, just do it.
So we're going to move on to our third and our final myth. Is it true that you need to eat more calories or double your calories because you were out eating for two?
No, it's not.
Unfortunately not, no.
No, unfortunately it's not. Officially, you don't need to increase your calories until the third trimester, even then it's 200 to 300, which is probably the equivalent of like a cereal bar or something in that region. So this idea of eating for two actually doesn't promote healthy weight gain in pregnancy. Yes, you will gain weight during pregnancy, but we have to remember the additional fluids, the baby itself, your placenta, all of those have a mass, so there will be healthy weight gain. There will be weight gain through that, but we want to promote healthy weight gain through that as well. And yes, exercise is fantastic, but we want to be considering that if everybody is telling us to eat for two, then that could increase your chance of gestational diabetes. Preeclampsia can come from having, from weight gain as well. So it's really important that we actually are like well aware of that as well. Equally, on the flip side, we want to be kind to our bodies. In the first trimester, there is a strong likelihood that we're feeling more nauseous, dizzy. The lack of blood volume is going to find you're not feeling as great as you could potentially be. So yes, you might be encouraged, you might feel like you want to eat those beige foods, eat the beige foods, you'll be absolutely fine. If that's what gets you through the day, like helps you stop being sick, then do that. That's absolutely fine. We're not here to shame you for eating, but we want to be considering, is there one nutritious thing we could get into there? Could we get one vegetable in there amongst all the rich tea biscuits? Can we get a piece of fruit in there? But hopefully after the first trimester, you should be starting to feel significantly better, less nauseous, And then hopefully we can be really looking to kind of promote good sources of protein, good sources of like fruit and veg, carbohydrates. But again, we don't need to be eating for two. That concept is really outdated.
So it just comes down again, I guess, to just normal nutritional advice that you would give. It's like, we're not saying that you can't have these things, but have them in moderation. Try and get as much good quality, nutrients in there as you possibly can. The training, if hopefully you're active, is going to offset that to a certain degree. You're going to feel better. But I guess just hoping for a really, really kind of healthy and nutritious craving, I guess. Like just eat pickles the whole time, right? Low calories, would be much easier.
From that, it's a bit intense.
Yeah, but see, I could go through a whole jar of like pickled red cabbage.
Yeah, but you're never going to be pregnant.
Not pregnant.
You're not going to be pregnant eating red cabbage.
But like, it's just like, I just feel like I'm like, I feel like I've got like an iron stomach to it now. So the pickle thing can definitely work. Have you had any kind of weird cravings on the nutritional front?
Yeah, not really. Did we even mention that I was pregnant, by the way? I don't know if we did, but I am. In case anyone's
true. Yeah.
But yeah, so it's my second pregnancy. I would say at the beginning, I mean, like Gemma alluded to, like you do just feel horrendous. Well, not always. Some women don't have as many symptoms, but I generally felt horrendous. So if you'd have seen my diet at the beginning, I mean, actually, because you don't feel that great, you're probably not eating ridiculous amounts anyways. You probably are not eating more than 200 more than you need on a daily basis. But I think it's the types of food that you're eating. You're like, oh, I'm literally just eating everything beige because the thought of protein right now is making me feel quite sick. But then you get over that point, and I think, like Jem said, it's just trying to get in as much good nutrition as you can. But I mean, again, if you still looked at my diet now at this point, you'd be like, okay, she's having a donut here, she's having this and that, just because that is what you feel like. I've probably gone a bit more salty stuff than I normally would.
Oh, really?
Like, I'm not really a crisp person, but I feel like I've had more packets of crisps this pregnancy. And love corn. Remember I ate that whole massive bag of love corn.
Which flavour?
Keeping love corn in business for sure.
Any. But maybe not the whole bag. So yeah, I mean, you can see even then I've probably gone over. But I think it's just like everything, with being pregnant or not, moderation, like having a bit of intuition about your body, understanding that you don't need to, eat for two and just really go overboard, because unfortunately with that weight gain, it will then become even harder after birth to try and get back to where you were, or closer to that. But I think that, just be kind to yourself. Like, your body's going through a lot of change, hormonally, a huge change. You might be feeling great. So if you do need whatever it is to kind of keep you going, like, it's okay, it's fine. So your body's doing a lot of work. But we'll give it some credit.
Yeah, absolutely. Now we're going to round this one up, and I'd like to hear from both of you. I'm sure the advice would be quite similar, but I'd like to hear from both. If someone was thinking about whether they're pregnant right now, or at some point they're looking to be pregnant in the future, they're thinking about joining a gym or getting a coach or whatever, what would your best pieces of advice be? Based on the things that we've just said there, trying to debunk these 3 myths, what would your best pieces of advice be?
I think make sure the coach is qualified. There are a lot of qualifications out there that the coach should have. So ask that question. It's your body, you have that right to ask that question. Make sure that you have a really good communication with your coach. Let them know how you're feeling before the session. Keep those lines of communication open all the time, so you should feel and they should feel like you have that trust between you. They need to know how you're feeling during the session. If you're finding an exercise that last week was a 6 out of 10 on an RPE is now feeling like a 10 out of 10, tell your coach that. They aren't a mind reader. We're looking for signs of your breath rate increasing, look like potentially like sweat, all of those kind of things, but you're going to feel it before we're going to see it. So keep those lines of communication open all the time. Stay hydrated, take lots of water to the session, make sure there's lots of, like we were talking before, have ventilation, so you've got that. But equally, if you need to rest, take your rest, it's absolutely fine. But keep talking to your coach. always keep those lines of communication open, and you'll be all right. Enjoy it.
Yeah.
Enjoy it.
James?
So.
Enjoy
it.
it.
It's a great time. I would just say, if you can, please try and stay active when you are pregnant.
Yeah.
It is the biggest bit of advice I could give, because it's going to make you feel better. It's like we said, it's got proven results for both you and your unborn child. There's like studies that basically say that their lung development and their circulatory system is like massively benefited from it. So try and stay active, but be kind to yourself. And the days that you feel like rubbish and you're not going to be able to get to the gym, again, that's okay. Don't put pressure on yourself. There's been weeks in this pregnancy, like not many weeks, but like a week or so that I haven't made it to the gym, and that's okay. You've just got to change your expectations. But yeah, stay as strong and as fit as you can. It's going to set you up in the best way post birth and just for the rest of your life. So yeah, stay training.
Amazing. Thank you very much for your time, both of you. It's been awesome. Ladies and gents, there you go. Episode 7 is in the books. Please do remember this is an entertainment podcast and is not meant for medical advice. So if you do have any queries or questions, contact a healthcare professional. We will see you very, very soon for episode 8.